I am Dr. Kathleen Chard, and I run the Trauma Recovery Center at the Cincinnati VA Medical Center, and I'm a professor at the University of Cincinnati in the Department of Psychiatry and Behavioral Neuroscience. We know that almost 8% of the civilian population will suffer from PTSD at some point in their lifetime. So actually this is something that faces many, many families who don't have soldiers. The number one challenge we face is stigma. So not only do we have the stigma about mental illness to begin with, but because PTSD is associated with a traumatic event, people are often very shameful about this event. They feel guilt about this event. They're worried that they'll be judged about this event. They may be blaming themselves unintentionally, erroneously about the event. And so the idea that they now have to share that not only do they have a mental illness, but also that some horrible event happened that they haven't been able to master or they've been affected by adds a second layer that makes it very difficult for people to come in to seek treatment. One of the myths I think about PTSD is this idea that you have to go into great detail, you have to go into the story over and over again. And what we know is that we have therapies now that have been shown to work with both civilians and veterans where you never ever have to go into any detail about your story, and they only take 7 to 15 sessions. Well, the wonderful thing about the center is we have our own staff that can help do the intake and see if the person is eligible for free benefits or if they have insurance that we can use. And so all they have to do is contact our main number, which is 558-JVSC. I think the number one closing remark is just that treatment is available, and more importantly, that it's brief. People do not have to suffer from PTSD. These therapies are 7 to 15 sessions. It's not a lifetime commitment, and we're out there if you want care.